Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guests are Gerry Blass, CEO of ComplyAssistant, and Margarita Derelanko, who's a former director of compliance at a network of mental health services providers in New Jersey. Both Gerry and Margarita are active in local and national health IT associations. Welcome, Gerry. Welcome, Margarita. Thank you for joining me.
Yeah, thank you, David.
So Gerry works with ComplyAssistant. As I said, he's CEO of the company, and the company is a governance, risk, and compliance software solution provider. To kick things off, I wonder if you could provide just a little bit more color to that description, Gerry. What are you doing? Who are you helping? Well, what are you trying to do through ComplyAssistant?
Sure. So we were founded in 2002 in the pre-HIPAA days, and we worked in HIPAA helping healthcare organizations get ready. And then around 2010, we deployed our platform, which is the GRC platform. We've enhanced it a number of times. The main aspect of it is to be able to provide functionality to help any really healthcare organizations that are covered entities under the HIPAA rule to manage the process more efficiently, exception management in a structured way. Compliance is difficult enough, so the platform is meant to be a way to make it more efficient. We know that there's limited resources in healthcare, so whatever tools they can use to help them become more efficient is very important. We also provide services as well. We do security risk audits on behalf of the hospitals and covered entities. So it's a combination of service and the software platform. And the goal is to help, when we say GRC, with governance, through transparency, with risk management, and with compliance.
From my perspective, and from others, I'm sure as well, the weakest link, so to speak, is often staff. It's not the hardware and the software. It's ultimately the wetware, as we used to say, the people who are controlling all of the software and hardware that can be the weakest link. And I'm wondering if there are any particular areas of concern that you two have identified over time that you'd like to talk about, employee behavior that sort of impacts cybersecurity and compliance. What are the things that people need to be on the lookout for?
From the lens of a compliance professional who may not always have access to technology and may have to sometimes revert to using other methods of detecting any type of warning signs regarding employee behavior in relation to compliance, privacy, and cybersecurity. So from my lens, it is definitely important to recognize those warning signs in order to maintain a proactive culture of compliance in an organization. For example, manual reviewing or auditing of an electronic health record sometimes may reveal providers who circumvent creating electronic notes instead upload photos of a form with clients' protected health information, for example. And at times you may ask yourself, what device were these pictures taken? Does your company have a bring your own device policy? If agency-owned cell phones are not provided, does your policy outline all the steps to minimize storage of protected health information and ultimately how to destroy such confidential information? So coming across outliers in an electronic health record, especially if you don't have the technology to use it and you do some manual auditing, manual review, may trigger a further review of HIPAA privacy and security policies and procedures and targeted education and training to enhance employee comprehension of those practices. But beyond that, with technology, I think we all in the compliance profession look to technology to solve some of our challenges with maintaining HIPAA compliance. And certainly, if certain secure technology is implemented in an organization for the purposes of maintaining HIPAA compliance, those troubleshooting questions, IT-related questions, typically will come to the compliance department, even though the department may not be the most suitable program to manage these technological solutions and functionalities. So not only is it important to redirect those inquiries to an appropriate department, but in my opinion, it is also a good idea to take note of these communications. Does the technology function as intended? Does it continue to safeguard the information? You can partner with your information technology to figure that one out. Do employees know how to properly use it? And if they keep asking those troubleshooting questions, are they using some other unsecure channels to communicate protected health information? And most of the time, if employees ask these questions, they know the right thing to do. However, it is always a good idea to be proactive, check in with them, and maintain open lines of communication from best practices standpoint. So those are just a couple examples of warning signs and how employers should continuously review their privacy policies and procedures, evaluate your training, engage your employees to fill the gaps, read those signs, because employees may be one of the solutions, but also one of the challenges that we have to face in the increasing cyber attacks world.
Yeah, the weakest link, as I said.
Yeah.
Gerry?
Yeah, so, I agree that the insider employee risk has always pretty much been deemed to be the highest risk, even going back to the beginning of HIPAA all the way up to today. And in the beginning, a lot of it was around things like employees selling charts of accident victims to attorneys so that they could go after the lawsuits. Employees looking at medical records of celebrities. That was a popular problem, maybe still is. But now, since the world has changed since the beginning of HIPAA into more electronic data, and healthcare becoming a primary target for attackers, the next thing, of course, that we've seen is the ransomware attacks. And that's where the insider threat is also there, and the risk in that employees may be clicking on emails or going to the wrong places and introducing malware, ransomware. The testing is a good way to see if there's any warning signs. And usually there is a percentage of employees who keep clicking and maybe don't get it at times, and they need to be, re-educated and given incentives to understand what not to click on. And I'm sure it's not always an easy thing to recognize. The other warnings can come from physical walkthroughs. Just walk through a facility, walk through a hospital, see what you can see. Are there screens that are in full view? Really, the acid test is, if I'm doing a walkthrough and I can see identifiable health information, then that's a problem. Are passwords being shared? Is hard copy data being left on copiers? Is it being left anywhere in public view? So physical walkthroughs are a very important thing to do from an activity standpoint. And then in today's day and age, there's plenty of companies that have technical solutions like AI-related tools on behavior in relation to accessing EMRs. It could be even rule-based, but there's ways of raising red flags around access. And those tools are great ways to determine if there's potential unauthorized access by employees. So that, technology is coming into play as well for warning. So between technology, the physical aspects, testing on phishing, in general, there could be plenty of warning signs out there.
Right. From my perspective, phishing is probably the most insidious issue of the moment.
Yes.
Number one, just because people don't necessarily recognize phishing emails when they come in, and we all seem to have this unbelievable compulsion to click on stuff.
Right.
Even though we sometimes know better or should know better. And,
right. And implications are large, just from the one click, just like we see in the media.
Yeah, and there's been examples where an email looks like it came from the CEO of the hospital.
Oh yes, we've all seen those. Right.
Yeah.
So how do we move people out of those danger zones? Does your solution support training modalities that can help your customers in moving forward?
Yeah, we have a variety of ways. We have some free tools on our website. We have security reminders for the workforce. We have a partner company that has an LMS, an online training solution. So that integrates into our platform when requested. And I'm sure that Margarita can talk about a lot of the stuff she did in her former place, right, Margarita? You can talk about that?
Yes. So in terms of training staff, which is key, I think we all know that, and that's always a topic for discussion. For those organizations that are not as technologically savvy or may not be able to invest in the technology that Gerry and his company may have, or other tools that Gerry mentioned, which frankly really excite me, and hope one day I'll be able to utilize some of these technologies, which really are targeted to empower compliance professionals to make our job more effective and easier, and be able to predict some of the behavior. So it's very exciting to see those developments in the industry. But my understanding, from being involved in associations, there are many, many organizations who are not in a position to be able to utilize these technologies. And so what do you have left? At that point, you really have to employ your enthusiasm around compliance training and compliance initiatives. In my experience, while compliance training may not be the most anticipated learning area for staff and new hires, if compliance professionals are enthusiastic and creative about compliance themselves, employees become engaged and eager to understand its complex policies and procedures. It's consistent with the thought I recently heard of switching from compliance training sessions to compliance engagement sessions, which then entail involvement, active participation, and also intend to develop interest in the topic. In my previous role, the compliance department of two, we wanted to find ways to demonstrate that employees can have fun with compliance, and they can educate peers on the importance of privacy, security practices. We used an array of methods, and I can give you a couple examples. One of them being peer videos. We would recruit staff from different levels of leadership, provide them with a short skit, involve the camera. Employees would add their personalities, their own wording at times to explain a compliance idea. And in the process, they would remind themselves about how to operate within privacy and security policies. We would utilize these short videos for new hires and during the annual compliance week. Another fun and simple technique that we used was so-called photo hunts. And those are the types of ideas that are available online, but not as widely used as you may think. And you can run with them when you find them out. They would stage scenarios with, for example, unattended laptops with open electronic health records, confidential information laying around in a workstation, or any other privacy and security areas that we know we have a challenge around. And new hires or employees during the annual compliance week would be tasked to identify these red flags on the photos. These photo hunts would serve as gentle reminders. They were pretty popular among our employees. And even those that did not participate, they still saw the photos. So, of course, that hopefully served as a reinforcement of the compliant behavior. Speaking of gentle reminders, we would utilize stickers for educating our staff on privacy and security. For example, the stickers would say, if you suspect a cyber attack, report to IT, it's how you should act. Or client information is not to be seen, do not remove your privacy screen. So those are like silly things, but catchy phrases that would help remember what to do to maintain compliance can really make a difference. In that moment when you receive that phishing email, and you can think back to the sticker that you may have on your computer or on your notebook. What am I supposed to do? Because in theory, those concepts may be easy, but in practice, you need to know, how to react and how to act in those certain situations. So these and other engagement strategies are pretty simple, but they're effective, and I think they should be utilized more widely. They improve engagement and foster enthusiasm around compliance, privacy, and security.
Yeah. Sure, we can't just leave it to the annual 1-hour training video or something like that.
Right.
Right.
Yeah, just to pick up a little bit on what Margarita has talked about. So culture of compliance, it really begins at the top. It needs to be a top-down mandate. Leadership needs to make it clear to the workforce that they're all aboard, and that this is a big deal. And the employees do need to be empowered. It's almost like if you see something, say something, like Margarita just mentioned. And for example, since most employees at a hospital are taking care of patients, and that's their primary job, it's not always primary in their mind that they need to protect the information because they have so much to do. They're very busy.
Right.
We've done walkthroughs where we've seen on a big monitor patient tracking in an emergency department where the monitor had a woman's first name, last name, age, admission complaint, admit diagnosis, et cetera, and it was there because the physicians felt it was good availability of data for them. But obviously it was a HIPAA mistake. And, I happened to be doing a walkthrough and I saw this and I thought, this can't be, and it turns out that, no one thought about it as being an improper disclosure. None of the employees reported it. None of the managers reported it. And it took me being there to write it up to get it fixed so that it was de-identified, just have enough information for the physicians. That's really all they needed. But if employees know that that's a bad thing and that they should report it, maybe there should be a reward. Maybe they should be empowered with some kind of acknowledgement at the next big meeting. This employee let us know about a vulnerability from a physical security standpoint, so they should get some kind of acknowledgement. That would be an incentive. So there are ways to, really generate a culture of compliance. And again, it has to be from the top down.
Right. If you're just tuning in, this is Harlow on Healthcare coming to you on Healthcare Now Radio. I'm David Harlow, and my guests today are Gerry Blass and Margarita Derelanko. So we've been talking a little bit about practical approaches to promoting a culture of compliance. I'm interested in hearing if you have other practical suggestions here, because really this is a key issue, because we can't just relegate training to the once a year or once a quarter sort of thing. And I've seen positive results from using what I would call micro-learning opportunities, like a little tidbit of information rather than an hour's worth of information. Little bit of testing, little bit of creating competitions between teams within an organization on tests and quizzes and so forth. So other ideas that you've seen that you've used in terms of promoting a culture of compliance?
Yeah, well, security reminders, there's nothing more functional and impressive than to walk through a facility and see a workstation with a screensaver on. First of all, it's protecting any PHI that might be underneath it. And secondly, it's being used for security reminders. So as that screensaver is in effect, you see, never share your password. If you see something, say something. You're the eyes and ears of the organization. Do not leave hard copy PHI anywhere in public areas. Make sure that you are protecting your screen. Make sure you have a filter on your monitor. All those security reminders can be being displayed on a screensaver. And, there's nothing more impressive to even an audit by us or an audit by the government to see that kind of functional reminders in place for the workforce. And it does give them the continual tidbits of reminders. And Margarita, I'm sure you have seen that and other approaches.
I certainly agree with Gerry. Anything to make it easy for the providers to be able to function in a compliant manner. And certainly it is their responsibility to understand those practices, read the policies and procedures. But if it is our duty, being in a compliance role, to ensure comprehension of those policies and procedures, if we truly want to be proactive and generate that culture of compliance, and to be able to think of easy ways of allowing them to do that. And generating culture of compliance really does take time and devotion. Culture of compliance can be very delicate, needs constant reinforcement by building relationships with departments, attending staff meetings, just being in tune with what's happening in the organization, being visible, being responsive to employees' questions and needs. And to achieve these goals, I recommend exercising the CARE philosophy that I've developed over the years, which embodies simple concepts such as compliance awareness, reinforcement, and engagement. To create compliance awareness, it's really easy to do in your organization. For example, just by being able to be there to provide tips to a new hire on day one to ensure their success. Something that we've done in my previous role, we would supply a HIPAA 101 training on the first day of someone's employment, a very quick, short reminders around privacy, because you may be surprised just how many individuals coming into healthcare do not have that background, understanding around privacy and security, just by virtue of not being exposed to, whether at the previous job or at a university. And if we certainly don't expect the retention on day one, and we know day one is pretty stressful for most employees, but just creating that awareness that there is a compliance department, those are the key takeaways, the key areas for you to remember. That has been effective in my previous roles. Hanging posters with privacy slogans, again, something catchy, especially if you are able to use your own employees, is very helpful, just to be able to allow them to be those spokespeople for you and exhibit the compliant behavior. That all of that creates awareness. In terms of reinforcement, according to James Clear, author of Atomic Habits, on average, it takes about actually more than 2 months before a new behavior becomes automatic. The compliance department really need to nurture the compliant behavior continuously because it takes such a long time for something to become automatic. And of course, in an ideal world, we want those behaviors to be automatic. We want someone in a healthcare role to maintain privacy, to protect confidential information. But we have to continue reinforcing that behavior among new and seasoned employees. I talked about making something complying with complex policies and procedures easier for employees. For example, creating a slide deck with one HIPAA policy per slide, with actionable items and how-tos that are derived from the policies, something they can quickly refer to, or if they have a moment and they have a question, they can always refer back to the slide deck and not just look through pages and pages and pages of HIPAA policies and procedures, which most organizations, I'm sure, have tens and tens of pages around privacy and security. And as far as engagement, another method is, like I mentioned in the CARE philosophy, the engagement piece is critical, and demonstrating to employees that they already exhibit the compliant behavior when you meet with them and you talk to them about their operations, about their programs. For example, during a compliance engagement session, you may ask the audience, what are those everyday activities that you do that help maintain compliance? And when they respond, you'll see that some of them already know what to do. They just have to be reminded of. They'll say, oh, I lock my laptop before I leave my desk. I clean my desk and lock my drawers at the end of the day. I keep my password safe, and so on and so forth. And I know when I'm supposed to talk to the compliance department if I have a question. And those can really serve as gentle reminders too, and especially those who may have forgotten those concepts, and empower those that are already exhibiting that compliant behavior and potentially make them want to take it to another level. Just while going back on the CARE philosophy of compliance professionals, privacy security professionals, using that philosophy and just thinking around awareness, reinforcement, and engagement around compliance can really help make your program more effective.
So we often think very deeply and extensively about using technological tools to assist in this domain. But what I'm hearing from both of you is that we really also need to step back and really connect with folks at a more human level as well.
Yes.
Right.
So to wrap up today, I'd like to ask you both, if you were to wake up tomorrow and find yourself 5 years in the future, what's one thing in healthcare that you would either hope or expect to find has changed dramatically?
Well, from my standpoint, since I'm living privacy and security, every day, I would love to wake up in 5 years and see that there's much more funding in budgets for resources and for controls, and that the CISO, the Chief Information Security Officer, is more commonly empowered in a position of executive, unbiased from IT, and able to operate independently, to audit and to keep an eye on what's going on in the organization, such as a financial auditor doesn't report to finance, it's separate. So an information security officer should not report to IT. We see that in many instances today. So I would hope for that to be different, more common, that they're independent, and that, again, they really do need to increase resources around privacy and security as we go forward.
Margarita, anything to add?
Sure. I agree with Gerry in terms of resources, and my hope is that 5 years in the future, the new generation of healthcare providers will come from substantial education around compliance and privacy from undergraduate and graduate schools. This would be consistent with Generation Z workforce, thought to value integrity and trust in organizations. The new privacy legislation that we all know about, for example, the California Consumer Privacy Act, which kind of can also support the increase in resources to an extent one day, if it expands. In addition to the heightened tensions on the organizational culture of compliance in the media. So in my opinion, universities should know these events and put future healthcare providers on this path of success by providing those foundational compliance and privacy courses within their programs, which are limited nowadays. And I think that we compliance professionals can certainly help universities in this endeavor and begin creating that proactive culture of compliance from the very start of someone's healthcare career, focusing on privacy, security, and compliance.
Well, thank you both for joining me today. I appreciate it.
Thank you, Dave.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.